Hello, everyone. This is Jan Chozen, and I'm a longtime pediatrician and also a longtime Zen teacher. And this is another one of our exercises for mindful medicine. It's called breathing together. So for one day or 1 week or 1 month, however long you'd like to try this, whenever you're listening to a patient's breath sounds, to listen under their clothing, on their skin. And after you've listened with a diagnostic ear, then to pause, and they won't know that you're pausing, and then to listen and match your breath to their breath for at least 3 breaths. So how to remind yourself to do this practice? Often that's the hardest thing, is to remember to do the practice during a busy day. But one way to remember is to tie a piece of colored yarn or a piece of colored tape around the bell end of your stethoscope so that when you put it on a patient's chest, you can see the color, and that will remind you. So if your habit is to listen over clothing, which seems to be now the norm, which surprised me when I went to my primary care physician, then see, what do you discover when you listen underneath? Do you hear more subtle sounds? When I was in medical school, we were absolutely required to listen under clothing. And we were listening for subtle murmurs, for split S2 sounds, for wheezes, for crackles, for ralls, and we had to describe exactly what we heard to our attending. I remember one amusing incident where we were all, our first-year medical students, we all were assigned patients to do physical exams on with the attending, and we had a very severe surgical attending with us. And he said, Mr. Jacobs, listen to the patient's chest and tell me what you hear. And so our fellow medical student listened very intently with his eyes closed. And then he looked up kind of dismayed, and we were all laughing because he'd forgotten to put the earpieces of the stethoscope in his ear. He was so anxious. Even the attending thought it was funny. So why have we changed to listening over clothing? Is it that we believe that our technology, our lab tests, our chest x-rays, our echocardiograms, and so on are more accurate than our own senses, the things that we hear or the things that we smell or that we touch? Are we trying to fill our hourly quota now that medicine has become a corporate business? Do we feel like we can't take the extra time just to lift up a patient's shirt and listen on their bare skin? Have we become somehow avoidant of touching patients on their bare skin? Do we believe that a physical exam is almost always normal in a patient, and so only if they're really sick, like with suspected pneumonia or heart disease, do we really need to listen carefully? I'm not sure. Our greatest human longing is for connection, is for intimacy. And medicine used to be more intimate, partly because we touched people and we weren't relying on the technology, which is fantastic development. When we're practicing matching breaths, even for a few breaths with a patient, it slows us down. It brings us into the present moment, and patients can feel that, even if we do it just for a few breaths, that we are really present with them, that we're making a purposeful connection, both for their benefit and for our benefit. We bring ourselves into the present moment and we link ourselves to this other warm, living human being. And to me, that connection is the essence of good medicine. Often in hospice, and one of our sons is a hospice nurse, they recommend to family in particular that if they're sitting by the bedside of somebody who's ill or dying, that to relieve their own anxiety and distress, that they match their breathing to the breathing of the person who's dying, even just for a few breaths. And again, The purpose is to bring the person who's sitting with the dying person into the present moment and into connection with this person that they love. So the exercise for this day or week, or as long as you'd like to do it, is to listen to a patient's breathing for your medical reasons, but then for a few breaths, match your breathing to theirs. When you listen to a patient's breath, you are listening to the ebb and flow of their life energy. And when you match your breathing to theirs, you are also listening to the ebb and flow of your life. Thank you.